Good afternoon, everybody. My name is Phil Leahy. I'm an Open Athens account manager, and I'm here to introduce Darren Hutton of NHS Digital, who will be giving our opening keynote. Darren's a product manager, a product owner, I beg your pardon, for NHS Login, and he will be talking about how NHS Digital developed a national identity verification platform, the main drivers behind that project, the benefits to patients and key stakeholders, and some of the results his team have seen so far. I should also say that ClinOwl are sponsoring our opening keynote today. ClinOwl curates articles from leading medical journals into a single view, so busy healthcare professionals can discover relevant clinical content and keep up to date with the latest advances in medicine. So there will be an opportunity for a Q&A at the end of the session, so please submit your questions via the Q&A box and we will answer as many as possible. So we will see you after the presentation.
Good afternoon, and thank you for having me here today. This is a welcome break from what is a very busy time, as you can imagine, at NHS Digital. And it looks like a fantastic lineup of topics and speakers. I'm really looking forward to it. Hi, everybody. I'm Darren Hutton, product owner within NHS Login. It's an identity service for patients in England. Firstly, I'd just like to say how difficult it's been kind of, putting this talk together, condensing what's 3 years of phenomenal development by a very talented product development team. It's given me a real sense of pride putting it together and triggered, some real great memories about how the team went about this. I'll come on to what that's happened over the last year, covering some of the approach that NHS Login has taken in response to the pandemic, which you can imagine has been quite significant for our team. Showed a lot of people in NHS Digital who predicted, modelled and worked on the impact of a pandemic. Our team wasn't one of those, it wasn't on our radar. But NHS Login has been a critical tool in the response to that. You won't see a huge amount about it on the news. You may never have heard of it. It's kind of a service that sits there and works within an ecosystem of others. And it's really helped that channel shift into virtual online healthcare throughout the pandemic. But it wasn't built for that. So why did we build it? Well, patients could already access GP records. They had systems provided by the GP system suppliers that could provide access to things like appointment booking and view your and order repeat prescriptions. But that required a user to go into the GP system. The GP practice would, the GP practice would create that user's account, give them access keys, and do any required ID checks at that appointment, which was great. But it doesn't help. Doesn't help all the new services that are cropping up, online consultations, meetings such as that. There's a thriving healthcare market out there, digital healthcare market, and they need to overcome two challenges. One of that is interoperability, which NHS Digital does an awful lot of, providing integrations into healthcare records, which require identity and authorization, which is where NHS Login comes in. Our team often says that we bank records are another system that sort of has this high level of identity requirement to get into them, but your bank will compensate you if there's a breach of your record, if money goes out of your account unbeknownst to you, but there's no getting that back in healthcare. So you really need to know that you are dealing with the right patient. So those identity checks that we have to carry out are quite stringent and problematic for some users. We'll get on to that. So to solve this challenge and provide a service to the healthcare app market, a program of work was spun up. We needed to develop a service which could support that market. We needed to develop a service that users could trust. Seeing that NHS logo when you come to use a otherwise unknown app from the App Store gives it helps the user have faith in the service that they're using. A recognizable, trusted brand, a very, very trusted brand. Where do we start? Well, what was quite a novel idea for NHS Digital at the time? Well, we started with the user. We built and iterated many prototypes, tested with 300 users. This is probably one of the more provocative prototypes that we developed in the first instance to see how people would respond to using things like Facebook and Google. And other identity services like Verify that were already there, you know, government access in healthcare. How would people feel about that? So we test out about 300 users. We've probably tested with over, I think it's over 3,000 now. So we do a lot of this. It helps us find problems within the service before we potentially release them out into the public. And also provides evidence for a lot of the things that we do over time. And it helps us get good content, good design, good language on the pages that actually helps the users, so that when we come to release either right back in the beginning or new features, they're good enough. They're not really polished. We haven't spent ages getting them to the best they could be. We get them out there, we get users test them, and we figure out from the insights that we get from that how well they work. So we had an idea of what we wanted to build, but we also needed permission. NHS Digital operates under legal direction as part of the Health and Social Care Act for storing and processing data. So we needed a policy document that would support that, and the standard was developed, catchily titled DCB 3051, which complements existing standards which are out there, such as Good Practice Guide 44 and 45, developed by the National Cyber Security Centre, which covers authentication and ID verification. Forming this standard took a lot of frankly difficult conversations with a lot of groups, privacy rights groups, clinical representatives, and institutions like the Information Commissioner's Office. But they were really good conversations to have, because they brought those people along the journey. We were getting buy-in from them to deliver this thing, which was going to deliver benefit for patients and the healthcare system as a whole. Getting that buy-in early was a critical thing for delivering. So we had that permission, and we had understanding what we wanted to do, and now we had some money. That money came from, at the time, Secretary of State Darren Hutton, who had there's an annual conference in the NHS. Every September, the Secretary of State opens that. And in 2017, he said that he wanted NHS Digital to build an app that would provide access to people's basic healthcare needs with their GP, like booking appointments and such. And he would stand up in a year's time and demonstrate that. So we didn't have much time, right? We had to really get going on this. 12 months does fly by. And we didn't really have anything tangible at this point. We hadn't built anything. We had a concept of the identity solution already. It wasn't designed with the NHS app in mind, but that was great. We'd already, we made progress there, so we could use it. And this is what we built. It's a service that does work similarly to Google Sign In. A user lands on a service, a health app or a website, and they see the button Sign In with NHS Login. And they click on that button, it redirects to NHS Login. They log in, simple username and password. Sometimes it can be two-factor, or it also supports FIDO, which is a more secure and actually better experience for the user, because it's passwordless. In fact, it's totally does not need any interaction other than pressing your thumb on Touch ID or something like that to get signed in. OpenID Connect is the standard that's used everywhere. It also makes it really simple for healthcare apps to integrate. They can integrate into this in just a couple of hours' time. And it's all built on serverless architecture, which helps it scale. There's some stuff about scale, as you can imagine, that we need to cover. And it's consent driven. So when a user signs into an app for the first time, the service needs to know who that user is. So that identity matching that's gone on for that user, we need to pass on that information. That might be the NHS number. That's a central record within the NHS of everybody's details. It might be there. They might need some contact details, phone number, email address, things like that. The user consents to providing those. They get essentially like a little interruption card to get that. And what if they want to access their medical record? If the service actually supports a system called Vectors of Trust, which allows the relying party, the healthcare app, to ask for different levels of ID and identity proofing relevant to the risk of the transaction the user's carrying out. Using vectors of trust, the service can say, I just need simple login. I need to know it's the same user coming back every time, but I don't really care who that user is. That's used in a number of sort of low risk transactions. But if a service is going to present medical information on that user, show your medical record, your appointment history, because that can have, you can show things like maternity or sexual health appointments. So, it's classed as sensitive information. Those types of transactions need to do identity checks, and the system works by doing online ID. It doesn't have to be online, it can still be in person for those people that can't achieve this for whatever reason. So it does work, has fallbacks for those types of things. But online identity is a challenge. It's a challenge, it's used quite a lot now within fintech. If you've opened an online bank account, or if you've an ISA investment or something like that, you'll have gone through the process of taking a photo of an ID document, recording a short video, or doing something with your face. We do exactly the same thing here. We try to get people through an automated check. That's faster and better for the user. We can provide a lot more feedback on the quality of the image that they take and things like that. If the user goes through that process, they take a photo of an ID document, passport, driving license, whatever they have, and then a scan of their face is taken on their device. Those compare the image on the document, the person, and we scan the details of the document as well and use those to try and match to the NHS number, find the record of that individual. If all goes well, the user's redirected back to the service they were signing into with a verified identity and the information that service needs to find them in their system, such as the NHS number. If for any reason the user can't get through the automated checks, there are manual checks. The manual check asks, it's very similar, take a picture, but then you record a short video, you've 4 numbers that you speak out, and then it goes to what we have an ID checker team. They can also pick up some of the automated checks for quality assurance processes and things like that. The ID checker team has faced considerable larger workload over the pandemic. We've had spikes of traffic that have brought months worth of traffic in a day. ID checking is hard. It's like our core focus, I would say now, in terms of like, where do we make improvements within the journey? This is the NHS, it has to work for everybody. The ID checkers are trained to not only by Border Force training in terms of checking the ID document is valid and not tampered with, and also that it's the person who's presenting the document. It's the same training that staff have that you see at airports. They're also trained in British Sign Language. So if somebody has to sign their response within that video, they ID checkers can check it's a valid video. But it's not just those usual. About 25% of people have some form of disability, but there are also temporary access needs that people have, such as mothers, new parents who are trying to register for healthcare apps. And I saw this firsthand at one of the services which is onboarded to NHS Login. Let's have a look at that. So eRedbook is a service that if you've got kids, you'll have had a Redbook for them. The Redbook is where measurements, immunisations, things like that get recorded into it. It's a history of your child through the early years. A digital version of that. And at one of their pilot clinics to launch this, parents were asked to bring along an ID document so they could register for an account. You can imagine like mum trying to hold baby and take a photo of passport at the same time. It just doesn't work. So we've looked at a way for healthcare professionals to do that on behalf of the user without having to, take their ID documents off them and things like that, which they shouldn't be doing, or taking pictures on their own device. Getting out and about and speaking to users, finding how people use it is something that everybody in the team does, no matter who you are in the team, back-end developer. Obviously, our designers like to get out there and see people actually interacting with their systems, but everybody does this and we get real insights from that. NHS Login uses over 30 services at the moment. There's the NHS app, which is the largest number of users. But once you create your account in there, it's easy to sign into another service as well. The private providers, Co-op, Lloyd's Pharmacy, Evergreen Life, lots of apps that are out there that allow people to interact with the NHS in different ways. And that's really what it was designed for. lots of different services to spring up and come up with new ways for things to work. ID checkers, the system scales. It's built on AWS serverless architecture. It scales pretty well. AWS have got oodles of a capacity that we can borrow at short bursts, but people are a little bit difficult in terms of like scaling. We can't just scale them out or scale them up. So what do we do there? Well, some of these burst patterns that started at the beginning of the pandemic, we had, I think it was about maybe 15 ID checkers at the start of lockdown. February 2020, we were seeing about 10,000 new registrations. When lockdown happened in March, that went up 500%. And we had a backlog of checks to do, which is stressful for the staff and also not good for the users. Users expect to get access to the systems that they want very quickly, and that backlog was causing delays to that. One of our data scientists took a probabilistic programming model called Pyro, which is developed by Uber for forecasting demand and redirecting drivers to where surges are happening. That same system, we predicted and modeled where surges would happen in the system and how we would have to respond to that. That's helped both a sustained recruitment program of ID checkers, but it also we also used it to train. As a response to that, we trained a lot of staff in NHS Digital to do the same process as what the ID checkers do. And if we have some of those big spikes, those staff are able to change whatever job they're doing at the time. They can be developers, project managers. Anyone was able to register for this. And those people are able to change what they're doing and get called up to do some checks to help any sort of like spikes in traffic. And one of the largest spikes that we saw in the last year was actually when the COVID tracing app was released, which was September last year. A lot of press around that, understandably. However, at the top of the App Store was the NHS app. So at the time, so lots of people downloaded the NHS app. It caused an awful lot of traffic to come in our direction, which meant that there was a lot of ID checks to do. Fortunately, that planning that we'd done, that predictive modeling and training of new staff, it meant that actually we had the ability to bring more people along, do those checks, so it didn't actually have a major impact like it did at the start of the pandemic. And you can see actually on this chart, it's got a lot busier over the last month. This is due to people doing test at home kits for lateral flow testing. If you're a parent, child at school, you have to do 2 tests a week now. I did my nose prodding last night. And actually, I'd have to redraw this chart now because last week we had 600,000 people new registrations. So this is going up significantly all the time. So we scaled our infrastructure scaled well, our ID checking team is scaling well. The final bit of scaling that we had was our support model. So our end user support team are critical. They help users when things go wrong. We try and help users the best we can to solve their own problems, but sometimes they need that extra little bit of help. In about 2019, 2% of new user registrations resulted in some sort of support incident, not critical incidents, but I need I can't get my 2-factor code sent by a text message or something like that. And if we carried on at that rate, we'd be seeing about 7,000 support incidents a week, which is just unsustainable. So we do a lot of work looking at insights from teams working on this. So we have little mini teams of design, support, things like that. Those teams I meet with on a weekly basis or fortnightly on some occasions, where they bring insights, trends and themes and things that they're seeing that help form the backlog of work that we're doing. That means that we cut down on a lot of potential problems that people would have had, things that we might not have picked up in research. Real life is different to research. So when we get it out there, that's why I say get things launched quickly, learn from that, so you can quickly build and develop on top of them. That 2% of incidents has been reduced to 0.1% as of today. 0.1% of incidents means that we see about 300, 350 per week, so a much more manageable level of support incidents. And that's been really important to give people more success getting through the system. And NHS Digital operate a world of DevOps, which means that the team that build this is supporting it, which is great because it means that, you know, they build it with a sense of how am I going to support this? So it's really well, you know, troubleshooting's baked into it. You know, try not to release bugs. Nobody wants to release bugs, right? But if you know that you're going to have to be the person supporting it and fixing it, you're much more likely to make sure that, you know, it's high quality system that's out there. If you're not doing that in teams, I really do suggest that you do shift to that DevOps world. So what's in for the future? Well, we're never too sure. Obviously, we didn't predict the pandemic. It is bringing a lot of new services, say about 5 a week, and we've got a lot in the pipeline. As people start to return to, as things were before the pandemic, I think online healthcare isn't something that's going to go away. That increasing convenience, an improved experience from a GP's perspective as well. You know, they can see you at almost moment's notice if need be over a video consultation. It's going to be something that continues. We're not too sure if the COVID status will become part of this. We don't even know if that's going to be a digital solution or, you know, paper-based certificate that people get for international travel and such. But we have to be ready for that if it does. And we're testing out the concept of an NHS account where you go to NHS UK, which is currently a content-based service, information on healthcare, but actually you can't do much interaction with it. But if you could go there and manage your NHS account, you know, if you could change GP, update your contact details, change your address, all of these things in one place that are sort of provided nationally, but there's no one national place to go and do that. So we're currently researching that with our users, and we expect that could be something that comes soon. GP systems, if they move over to this, which they are doing, that'll mean less burden on the front line. So they won't have to be creating and managing accounts for users to access their systems. We'll take care of that for them. It's currently 6 million users on this. We've got a target around 25 million, which is the active healthcare user in England. It's quite dormant, you know, not everyone's interacting all the time, but that's our sort of target for this. Service is free to use, not obviously for patients because it's the NHS, but also those consuming services. We don't charge them for users logging into their service. It's a benefit to the healthcare system as a whole, so it's funded centrally for that. So yeah, so in some really interesting times ahead for the service. So thank you very much. If you haven't downloaded the NHS app, do so, get it downloaded, try out at NHS Login, and see how you get on with it. Thanks very much for your time.
Thanks a lot, Darren. Okay, so we've got about 7 minutes for questions, and we've got a few in already. So firstly, do you think the experience of quite heavy identity validation that you described turns people away? And if you do think that, or NHS Digital do think that, do you have any measures in the drop of engagement?
Yeah, sure. So it is one of the, it's certainly a challenge for users who have to go through this process for lots of different reasons. That can be challenges that they have. They might not have an ID document that's required for it to do it online. Backup, as I say, in the means of getting those checks done in person. So you can go to your GP practice office. That's not something that we're wanting to try and promote at the moment. But we're forever testing to try and improve that experience for users, to try and ensure that people get through it. We track that on we have a weekly dashboard that gives us we can see where changes that we introduce into the service may have a knock-on impact on those KPIs. But I think the key thing for us is only doing those checks when they're absolutely necessary. The service supports different levels of identity proof, and for those services that are consuming it, which don't need to present sensitive medical information to users, then we recommend that they go through at a medium level, which is much easier. It doesn't require, it's essentially a claimed identity. We need to know their NHS number. They can type that in along with some other information like name, address, and we do a trace to match that individual to that. It saves them having to go through finding their ID documents, taking pictures of it. Motivation also plays a huge part in that. That's a lot to go through to get, say, like an online prescription service, which you might currently just ring up your pharmacy and ask for a repeat prescription. It's very straightforward. Where we have seen higher uptake has been richer online offerings, so video consultations where, you know, there's a real motivation. I want to speak to somebody right now. Can I get through this service to speak to a healthcare professional? I can't get an in-person appointment. So where there's a real motivator to actually get through those checks, then that also changes that success criteria that we see on it.
Well, okay, that's interesting. Thanks. Another question about engagement. Has engagement via social media increased or decreased? There have been recent discussions in the wider world about them, essentially selling personal data, for example, and inundating privacy, that might make people think twice when it comes to medical information.
Yeah, I think the consent element of the service, in terms of when users are signing in, agreeing to what items of data that they are happy to share, is a key thing in terms of ensuring that the service is trusted. I mentioned like the trust in the NHS brand is huge, and we certainly don't want to be eroding the trust in that. There is as part of the service, when it comes on, we look closely at the service that's going to be consuming it. It has to have a direct benefit to the patient, providing a service, not just looking at, a service that might be used into signing up to hoover up loads of data to then be sold on for purposes or anything like that. So there is an element of due diligence around like the review of the services which are being brought on to make sure that that brand isn't eroded, that trust in the brand.
Which leads nicely on to the next question. How easy was it to get Facebook/Google/ add social media account here past information governance?
Yes. So actually, that prototype never made it into production. So we tested that with users to see how, to see what reaction they would have to it. There was a real sort of, I think some people in the team found it quite surprising that a lot of people were quite happy to use that. The problem with those services is that they're, although they're authentication services, they're not really, there's no verification in the identity of the individual. So anybody can create a Google account, and you don't really, actually, Google probably know who you are better than most people, right? If you've got a Google account, you've been using it for a while, but they don't present that identity as a verified identity to the service that you're signing into. One of the things that is important in a service like this is trust and liability. NHS Digital underwrites the liability for any misuse of account. So if somebody was signing in with a Google account, we'd have no ability to validate it was the actual user. One of the problems as well with Google and Facebook, although they may support two-factor authentication, you can't insist that two-factor authentication is used. And again, that's a mandatory requirement for accessing sensitive medical information, is that two-factor authentication is enforced. So as much as it would be convenient for a lot of users to be able to use that, it's not something that we've been able to implement, unfortunately.
Okay, thanks. And are you finding that take-up differs across age groupings? So there's a common perception that the older age groups don't interact much with the digital world. What's been NHS Digital's experience of that?
Yeah, that's certainly true of the service. That it's not to say that people of older generations can't use it. Whenever we're researching with older generations, I think so often we hear like, oh, I can do this, but I don't think other older people will be able to do it. But yeah, we do see, yeah, there's certainly, I think I saw a statistic from one of our research teams last week that over the age of 65, that 70% of those people over 65 struggle with online services. They haven't grown up with things like online banking and things like that. So it is a mind shift as well as a skill set that they need to acquire to do it. Again, we test with all sorts of people, from physical to cognitive challenges that people have. This is they're probably potentially users are at quite a vulnerable state if they're trying to get into, say, like an online consultation. They may be under a lot of stress and anxiety at the time. So we want to make the service as simple as it is to use. We do simple, things like only asking for one thing on each page, so that it's really easy for a user to go through page by page. There's not a data overload. They don't have to sort of go through, a full page of different things and then figure out one thing's wrong somewhere, and they're scrolling up to try and find which thing they've done wrong.
I think we've all encountered forms like that. Yeah.
Yeah. So I think everything from the NHS design system is intended to be simple to use. We test it to accessibility guidelines and beyond as well. So it really helps us make sure that it's as best as possible for those people that can get through it. If they've got the tech to do it, if they've got if they need to do the online ID, for those that can get through it, that it's as easy as possible for them.
Okay, you've got 15 seconds to answer this question, but it should be quite simple. When you say national, is the scope of your offering for the English NHS or all the home countries?
It's NHS England. Yeah.
Right. Okay. So what prospect do Scotland and Wales have of buying into that? 2 seconds. You
They
can
have
answer that one.
a separate system behind the scenes that we can't integrate to, unfortunately.
Right. Okay.
From a tech perspective as well.
Darren, thank you ever so much for your time and for your presentation.
Yeah, thanks very much.